We were first concerned with Michael's talking and understanding when he was about 3.5, when he was at nursery. He got referred to a speech and language therapist when he was 4.
When he started school, full-time school, that's when they recognised that he needed some assistance. Once Michael got referred for speech and language therapy, we were in the dark. We hadn't a clue or an understanding of what this was to be. You know, we didn't know what Michael needed.
Yeah.
We just didn't, did we?
No.
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 Speech and language therapists help children and adults with a whole range of communication difficulties, and they might work in a hospital, in a school, or in a community clinic. But when working with a child with SLI, such as Michael, you'd probably be working within a school setting. The child may need very specialist help to develop their actual language skills. Skills a child might work on include understanding the meanings of words, which is something they haven't picked up by natural processes and needs specialist teaching. Or it could include understanding different types of sentences, or even using words appropriately within sentences.
I learned history words, and I learned about it sounds like century and it sounds like centipede. And centipede have roughly about 100 legs, and a century means 100. I learnt joining words like because and but, and they're all joining words. Yeah. And you use them in sentences, like I like chocolate cake, but I don't like celery. Yeah.
Therapy has allowed Michael to understand the meaning of question words such as who, where and when, and how to use these in spoken and written sentences.
The child might also need to learn and practice strategies to help overcome their language difficulties. The child may learn to describe something if they can't think of the actual word for it, or they may learn to work out why they haven't understood something and ask the right question to fix it.
When I find words difficult, like a lobster, I would like describing it's red and it's like a crab and it's long. The teachers really helped me describe the word, because I used to think, I used to say I don't know that word, and then I did have that word, I did have a picture in my head, but I didn't actually describe it. But then the therapy people helped me.
One of the first strategies that Michael learned in therapy was to actively indicate when he wasn't understanding something by raising his hand and saying, "I didn't understand that, could you please explain that a different way?" Or, "What does that word mean?"
Sometimes people say difficult words, and I have to say, what does that mean? And I say, what I don't actually understand. Yeah.
It's important for a child with SLI to develop their self-awareness to understand both their difficulties and their strengths. Children with SLI have often had experiences where they feel like they failed over and over, and they can need help to see that it's not their fault and that there are things that they can do well.
Speech and language therapy has helped Michael understand that even though he has language difficulties, he has a lot of creativity, and he can use this creativity to come up with ways to get his message across.
Therapy has provided Michael the confidence to be able to speak up for himself, where before he would stand back because he can't communicate.
A really crucial part of therapy is to work closely with the adults in a child's life so that they can help support the child too. The therapist can help parents and teachers understand the child's specific difficulties, understand how to support them in different situations, and also give advice on developing language skills.
Michael's therapist has helped me understand what Michael's areas of difficulty are and how I, as a teacher, can help him in the classroom.
Speech and language therapist has taught us how to understand him a lot more. They've shown us the way to help him and understand him.
It's just given us tools. That's what it has given us.
It's the tools to use.
Speech and language therapy has helped Michael have confidence in himself and made a significant difference to his learning and how happy he is in school.
Speech therapy has given Michael the skills to be able to live a normal life and achieve what he needs to in his life and communicate clearly and represent himself.
He's opened his life. That's what he's done. He's opened his life.
Therapy have taught me to talk to people and help in lessons and make me better what I do.